Welcome to the Accessibility Innovation Challenge Global Venture Showcase. My name is Delisha Patel and I will be your host for the next hour to hour and a half. I'm a British Asian woman of Indian origin with short dark hair and I wear glasses. I'm a social researcher from the Global Disability Innovation Hub, often just said as the GDI Hub, so we're one and the same. And I focus on gender and disability inclusion. And I also have a background in reproductive and sexual health research. So I'd like to thank you all for joining us today to hear about the incredible work we've been undertaking for the past 6 or so months. It's been a very exciting time. And it's great now that we're here to be able to hear, see, feel how far we've come. We've got a really exciting schedule for you where we'll hear from all the partners from the UNFPA, the Global Network of Young Persons with Disabilities, and the GDI Hub. And then, most excitingly, we'll move on to the 4 winning ventures and we'll hear about their innovative solutions on how to address barriers to sexual and reproductive health and rights facing young persons with disabilities. Now, through the webinar, if you do have any questions, do pop them in the Q&A or the chat box that's available, and we will try our best to get to them through the webinar. If you have any specific questions for the ventures, I will, at the right time, tell you how we will be going through those. So welcome again, and without much further ado, I'm going to introduce Nagina, who is the Chief of the Innovation Unit from the UNFPA. She has been and still is leading very exciting work on innovation and has been described as a disruptor of inequality and an advocate for gender equality. And it gives me very great pleasure to hand over to Nagina.
Thank you so much, dear colleagues, participants, winners, innovators. I am Dr. Nagina Muntian. I'm a middle-aged Asian woman with short, straight black hair, young in spirit. It is my pleasure to welcome you all to the Global Venture Showcase of the Accessibility Innovation Challenge. As you know, over 1 billion people are estimated to experience disability. That is about 15% of our 8 billion world's population. The number is rising. And their unmet needs are rising too. The urge for innovative solutions is rising as well. That's why we launched Accessibility Innovation Challenge by and for young persons with disability under the UNFPA flagship We Decide program. We wanted to find simple but effective solutions that can address complex issues that women and young persons with disability encounter on their everyday life when they're trying to access information, in commodities or services in the sexual reproductive health and rights. Out of over 200 applicants, we selected the best 4, just 4, and they were the best with the most promising proposals. So let me extend my congratulations to the 4 remarkable winning ventures: Technoprize Global, Alianta Infonet, AccessAble, and Vessels for Development. They're all very different. They come from different countries and the solutions are very different, but they're all very exciting. Your dedication, dear winners, and innovative solutions have demonstrated the power of inclusivity and technology in reshaping the landscape of sexual and reproductive health for persons with disabilities. And I'm sorry, I'm competing with the noise of the sirens on the street. Your accomplishments show us a path towards a world where every individual, irrespective of ability or circumstances, can exercise their rights and access crucial health information about barriers. For us, innovation means doing different things and doing things differently. Through conversational AI for inclusive data collection, empowering content creators through podcasting, information access via conversational flows, and inclusive reproductive health initiative, you have really demonstrated that innovation can ensure accessibility and empowerment of those often sidelined and marginalized. This challenge wasn't just a competition, it was a teamwork where young innovators work together and show how strong we are when we are united. So the United Nations Population Fund, Global Disability Innovation Hub, and Global Network of Young Persons with Disabilities joined forces, and the result is just amazing. This partnership demonstrates our common goals and of inclusion, having voices heard loud and clear, and creating a place and space where young people can grow without any limits holding them back. We are almost at the end of this journey, and I'm looking forward to see what are you going to present today. But the journey doesn't end here. That's just the beginning. It's a stepping stone towards broader horizons. Your initiatives directly contribute of improvements of health and well-being of many, many thousands, maybe millions of women and girls. And I hope you will continue this journey with the same inspiration and dedication. So again, my deepest congratulations, but also gratitude to every participant, mentor, judge, and partner who took part in this journey together with us. I know together we can change the world. Thank you, and over to the next speaker.
Thank you, Nagina. And I join you in thanking and congratulating the ventures. As we heard, we had so many submissions to this challenge, and it was tough to pick these amazing four, focusing on the barriers of sexual and reproductive health and rights to those that are often marginalized. But we will move on to our next representatives from the Global Network of Young Persons with Disabilities. And I've had the great pleasure to learn from Karthik, who's the founder of the Global Network and is the Accessibility Innovation Accessibility Innovation product manager at Microsoft as well. And we'll be hearing from him and Layla Sharafi, who is the Senior Gender Advisor and Officer in charge of Gender and Human Rights Branch at UNFPA. They'll be sharing some very exciting news with us all, and I will hand over to Karthik and Layla now.
Thank you so much. And good morning, good afternoon, everyone. My name is Layla Sharafi. As I was introduced, I am a middle-aged woman with dark hair of Asian descent. It's such a pleasure to be here today. Before we get into a nice conversation with Karthik, I just want to have a moment of your attention to give a quick background on UNFPA's work around promoting disability inclusion in the context of leaving no one behind. We're proud to say that disability inclusion is really a core part of our current strategic plan, which goes from 2022 to 2025. We're building disability inclusion to our 3 transformative results, which focus on ending preventable maternal deaths, ending the unmet need for family planning, and ending gender-based violence and harmful practices. Our We Decide program, which is our global flagship initiative on disability inclusion, which has been possible with the support of the government of Spain, has strengthened disability inclusive prevention and response to gender-based violence and strengthened sexual and reproductive health and rights around the world at global, regional, and national levels. Through the We Decide program, we've tried to demystify and destigmatize sexual and reproductive health and rights of women and young people with disabilities, both in UNFPA, but also across the globe through our programs with partners. For instance, the multi-sensory exhibit Wanted, A World for 1 Billion, launched in 2022 at the Global Disability Summit, showcased the autonomy and self-determination of women and young persons with disabilities, who really are spearheading change in accessibility and advocating for bodily autonomy for all. The exhibit was also featured in Oslo, Helsinki, and New York. Another important way UNFPA supports governments and partners is by establishing guidance and norms. Guidelines developed by UNFPA and Women Enabled International have been influencing policy and practice in over 70 countries around the world and have been instrumental in ensuring disability inclusive and gender transformative sexual and reproductive health policies and services for persons with disabilities. And now I'd like to turn to Karthik Swani, founder of the Global Network of Young People with Disabilities and AccessAbility Innovation Product Manager at Microsoft. Karthik, thank you so much for joining us. I'd really like to get into a nice conversation with you and ask you, could you share with us how the Global Network came into being and a little bit of the history? Over to you, Karthik.
Yeah, no, thank you, Leila. It's always a pleasure to talk to you. And thank you all for joining in. And a big congratulations again to our winning ventures. It's been such a pleasure working with you over the past couple of months, or some transformative innovations that you've been working on. And I can't wait to see how some of these innovations would have tremendous impact on the lives of young women and girls with disabilities. But a little bit about the global network, and I'll be using a couple of slides. So if you go to the next slide, which really is just a title slide, a little bit about our platform. But really, how the global network came into being was this consultation that we had around this time of the year. Uh, Really 3 years ago in 2020, this was around the International Day of Persons with Disabilities, and this was also the time when the world was going through the pandemic, and we wanted to get a sense of how young people were faring, and what were their challenges, what were their perspectives, what were their needs and aspirations. And we got together young people from over 60 countries, which is really good to see. And a couple key themes emerged from this consultation. And one of those themes was the lack of participation or tokenistic participation, not enough platforms to be able to participate and share their perspective with international organizations like the UN, or even otherwise with governments, etc. And people really wanted to be heard. And in a way, we were double disadvantaged, first by our disability, but also by our age. And so this was a big challenge. There were also a big issue around access to information, access to inclusive information, and about various aspects when it comes to inclusion, and when it comes to sexual and reproductive rights and health, when it comes to inclusive education and employment opportunities, etc. And so that was yet another big challenge that a lot of people talked about, especially during a time when some of this information was so critical, and that people did not have this. Oftentimes, information was specifically for young people with disabilities, and ironically, this information was inaccessible, which was a big problem. And then also, there wasn't an opportunity for people to get together as a constituency of young people with disabilities and talk about some of these challenges and think about what they could do together to try and really bring about a difference. And that's kind of really got us all thinking, and that led to the creation and formation of the global network of young persons with disabilities, with the support of a lot of UN agencies, with UNFPA really spearheading this, given its focus on disability inclusion, especially as it relates to young women, girls and women with disabilities. And so it was really good to have UNFPA as a partner and a strong supporter of this sort of movement, and also thinking about how we can provide more opportunities. So that's kind of how we started, and it's been a long journey, and really grateful for all of the support from you, Leila, and from UNFPA. So yeah.
Thank you, Kartik. Well, it's been a pleasure to work with you and the whole network. And really, I forgot to express my enthusiasm at the start of this to say congratulations to everyone that's been part of this this initiative and this challenge. And we're very excited to bring all of this to our viewers today. So Kartik, when you established the network, I mean, how was the engagement once the network was created? Could you tell us a little bit about how the engagement was once you got it off the ground?
Sure, and I'll request the slide to go to the next slide, please, the problem slide. It's a problem slide, but really the engagement was amazing. We actually got people excited very quickly, and as I mentioned, we had young people with disabilities from over 60 countries who got excited, wanted to do a lot, had a lot to contribute, had a lot to learn, and share. And we were able to create this decentralized structure very quickly, consisting of country and regional representatives, and they sort of leading and sort of spearheading a lot of this work as well. But we also were hit with the sort of the ground realities when you work with a global population of young people with disabilities. Again, many of the challenges that I spoke about earlier that emerged as key themes as part of the consultation. And so again, inaccessible information being one of them, there not being inaccessible and inclusive and easy to use platforms for various functions that we needed to support and further the work of the network, and to support the members, right from collaboration to being able to organize and work on projects and collaborate on projects, to access, for example, information about funding opportunities, to be able to access notices, circulars, and even documentation from governments and international organizations in formats that are compatible with their assistive technologies. And then, of course, if you think about the intersectionality that comes with disability in terms of, people not having access to the internet, a lot of people not being as tech savvy, people not being, not familiar with assistive technologies or new to assistive technologies. Um, just around literacy in general, for many of the people, English was not their first language or not even a language they spoke at all. And so then the real challenge was, well, how do we ensure that we're really being inclusive and deliberate in how we're trying to represent young people with disabilities, so that it's not just a few people who get this opportunity to be able to speak, or to have their voice heard by institutions like the UN, but it's really coming from the ground, and especially from the most underrepresented and vulnerable within our communities. And so, yes, it was very exciting, but also it kind of was a little challenging. And, I, coming from a tech background, wasn't really expecting or hadn't thought of it in this way as much, in terms of just how much we would have to think about, and how different the reality would be to something that, many of us think about, sitting here in the US or other places, and sort of developing technical solutions. So it was also very eye-opening for me as well personally. But yeah, it was a journey, and I have some exciting stuff to share with you soon. But over to you.
Yeah, no, thank you so much, Karthik. And I like to be optimistic, so I didn't even think of the challenge part. So I just got straight into the engagement. But yes, indeed, thank you for pointing out some of the challenges. I just am stunned when I see the statistic over 96% of digital content is inaccessible. I find that so shocking. But so obviously technology, as you mentioned, is a key component of your work, and the global network has really tried to tackle some of this, and has been working, I understand, on a platform to
Mhm.
solve some of these challenges. Could you tell us a little bit more about that?
Yeah, sure. And so, technology definitely has been a key part and a key enabler for us at the global network. Next slide, which is the solution slide, please. And it's really been technology and the community that has helped us the most. And so, when we started understanding and appreciating these challenges and talking to a lot of people, we realized very soon that we needed an inclusive platform that would bring together a lot of the functionality that our members really cared about, right? There are a lot of platforms that today provide, a lot of, these functionalities, whether it is networking or whether it's a bunch of other stuff, but they're all disparate, and each comes with their own learning curve. Many of them have their own accessibility, levels of accessibility or accessibility maturity. And so what we really wanted to do was try and see how we can unify a lot of that and make sure that all of it is accessible. And so that's kind of where we started the GNYPWD Accessible Connect as a way for us to be able to unify what we can do. Next slide around community features. And so I'm going to quickly talk through some of the features that exist in the platform. And a lot of the members have already been using the platform for a lot of their advocacy and for the projects that they've been working on. But really, it starts with community, right? Because that was the core of the formation of the global network, as a way for people to get together, for people to be able to kind of interact with each other and share what they're feeling, what they're going through, but also what they want to advocate about and how they want to plan some of these initiatives. And so it was really an opportunity for us to be able to get them together, and for us to be able to get them to talk to each other through projects and groups being, sort of one example of the various community features that exist on the platform right now. Next slide around community again. The other thing was networking, really providing this opportunity for people to be able to interact with each other, to get to know each other. Member profiles is a way for us to be able to, for members to be able to share more about their work, about themselves, where they're coming from, specific thematic areas that they might be interested in. And so that was kind of yet another sort of feature that we implemented that is being used, as well as easy and seamless ways for people to be able to interact with each other. And yes, there are platforms again, several platforms, whether it's Slack, whether it's Teams, whether it's, Google Meet or whatever, Discord. But again, we need to understand the diversity of people that we're working with. And so we kind of wanted to make sure that we were able to bring all of this together. And so that's kind of where community features again and seamless interaction played an important role. Next slide around upskilling. The other piece was capacity building. One of the key challenges that we observed was people did not really know about their rights, and were at different levels of maturity when it came to understanding how they can advocate, how they can launch movements and campaigns. And so we want to make sure that we're able to provide capacity building, help them understand more about, for example, digital accessibility, social entrepreneurship, even technology, how they could use tech for good. And so really our upskilling offerings bring together some courses that are created for and by young people with disabilities around various areas that are helpful to network members as they launch projects. Next slide. Around accessibility, this was yet another challenge, again, as I mentioned, and I want to again highlight that statistic from before, over 96% content being inaccessible, and just kind of let it sink in, because that's terrible if you think about it. Right? And so really providing ways for and integrating solutions that can help convert inaccessible content into accessible formats, also supporting text simplification, especially now with generative AI. There's so much potential, so we wanted to leverage that and provide that as something that people can use to access content, including content from outside the platform, in ways and formats that work for them, that are compatible with their assistive technologies. Next slide around information discoverability, really helping them to be able to discover a lot of this information as well, because that's a challenge. A lot of the information today is fragmented and scattered. How do we make sure that people are able to get this information and find it, again, powered by Gen AI? All of us have been using GPT, and so we wanted to make sure that we're able to support something similar, but without hallucination, or without a lot of the challenges that come with GPT-like solutions, without any noise, and so only getting the information from very reliable and trustworthy sources. Next slide around opportunities and fundraising. We wanted to make sure that people are able to think about and are empowered to think about sustainability for their projects. And so this is what you will be seeing in the slide is a listing of various grants and opportunities that we curate from the internet that they can use. They have filters are available for members to be able to filter, as well as an events calendar, which, by the way, had our innovation challenge. I hope a lot of network members are able to join as part of this event today. But also go to the next slide, really thinking about how do we help people write and craft compelling applications for grant applications, if they can share more about their projects and the grant RFPs, especially because, again, as I mentioned, English is not first language or even a language that many of our members speak. How do we make sure that we're able to provide them level playing field? Because it's really much more about the specific project that they want to implement, as opposed to how well they can articulate. So really trying to help them there. And so that's kind of really again, some of the features that we've been working on, and really trying to see how technology can enable a lot of the community programming and a lot of what happens as part of the project. And so very excited to be talking about the platform today, and again, grateful for all the support from the UNFPA in actually kicking off the platform development and continuing to support that. That's actually been extremely helpful, and it's really because of again your support that we're able to leverage technology in meaningful ways for our members. So yeah, it's been an exciting journey.
Kartik, thank you so much. Congratulations on this exciting new platform. It's been such a joy to support this from UNFPA, I must say. It's a packed agenda today, and you've had to go very fast over this. So before we close, I just have two questions for you. I know that the moderators are looking at the time very closely. But number one, where can people find more information about the platform? And then number two, finally, what's the future of the global network? Could you tell us just a few words about what you see going forward?
Yeah, and I'll request to go to the next slide, the future slide. Well, people can find this on our website. And so the way to get access to the platform is by joining the global network community. And so if you go to GNYPWD.org, which is the Global Network of Young Persons with Disabilities, GNYPWD.org, you are able to sign up and as a network member. One of us will be reaching out to you, and from there, once you're a member, you'll be able to access the platform and all of the the sort of the programming that comes with it as well. But also the the other thing really around the future, right? I think a couple things. One is we hope to continue to sort of build capacity. That's really important for us to ensure that people are able to advocate. They have an understanding of their rights as people with disabilities. But we're also thinking about how we can provide this platform across various again platforms like WhatsApp, for example. In fact, some of the innovations that you would hear about later today have been extremely inspiring to kind of think about how we can make this available to a much larger population as well. And so I'm actually looking very forward to also collaborating with some of the winners and trying to see how we might be able to leverage some of the tech that they've built to get the platform to more people using innovations like WhatsApp or platforms like WhatsApp, using platforms like IVR so that people are able to access the platform on over a phone call as well. So very excited about really democratizing access to information for all young people with disabilities, especially those that are the most marginalized within our community. And again, I think over the past year or so, sexual and reproductive rights and health, and just health in general, has emerged as a key challenge that our community faces, and so we hope to continue to invest significantly in this space as well. So yeah, that's sort of how we think about the future for the network and the platform.
Excellent. Thank you so much, Kartik, for all of this rich information about the global network and also the platform. Congrats again. And I hand it now back to Delisha.
Thank you both so much. Thank you, Kartik and Layla. Now, that was exciting. Thank you for sharing the platform. And having such a tool is so very much needed in today's technologically advanced world to help reduce the levels of, increased levels of digital literacy, I must say. And the link has been shared in the chat for everyone to have a look at their leisure. I will go straight on in our agenda. We have Daniel from the Global Disability Innovation Hub, and I have also had the pleasure of learning from Daniel and his expertise. He has a PhD in informatics and is the innovation manager at the GDI Hub and has incredible insight in problem solving, solution development, and innovation. So I will hand over to Daniel. Thank you.
Thank you, Delisha, and thank you, Kartik, Layla, for the real energizing conversation. It's
Sorry,
really my
Daniel,
pleasure.
we don't have your video. If you could turn your video on, that'd be fantastic. Thank you.
Is this on now, Louise?
Perfect.
There you go, of course. Amazing. So yeah, with video on now. Again, it's a pleasure to welcome all of our audience here, especially after such nice address from Regina and such energizing conversations with Kartik and Layla. So so to speak, the cliffhanger before the Global Venture Showcase. So I promise I'll keep it brief. And essentially, I would like to just introduce GDI Hub and our role in the Innovation Challenge, as well as leave you with a remark on one of the lessons learned and the case for utility. So I hope actually many of you have heard of the brilliant team behind GDI Hub and our innovation work, but just in case you haven't, GDI Hub is an academic research and practice center accelerating disability innovation for a more just world. We are based at University College London, which is situated in East London, which was the home of the Olympic and Paralympic Games back in 2012. We are the World Health Organization's first collaborating center on assistive technology, and we are working with more than 70 partners across more than 60 countries since our inception in 2016. And in this time, we have reached 34 million people, a truly remarkable achievement, I believe. We are also the lead on the 80-20-30 program, which is funded by UK Aid. And we are testing alongside all of our partners what's working in assistive technology. We do quite a lot, but closest to my heart is really our innovation team and the work we do in our innovation function. For example, the Accessibility Innovation Challenge. So you might wonder what our role was in there. And in May, June, when we started the conversations with the UNFPA and Global Network, we helped to design the program, just like we designed many other innovation programs in our venture studio, part of GDI Hub Accelerate. And we also helped to select those 4 winners out of the 200. That wasn't an easy task either. But then we went on, jumped into the exciting part from July all the way now to host workshops and webinars on topics like sexual reproductive health and rights, on co-creation with people with disabilities, but also more topics around leadership and participation. But really, the bulk of the time that we spent on the project was a lot more personalized or bespoke venture support, one-to-one mentoring, so to speak. But besides operationalizing the program, we like to say that the way we add value is really deploying innovation capital. And that usually comes in 3 flavors: in knowledge capital, in network capital, and financial capital. Now, the last one, I would really like to thank UNFPA and its donors for all the funding that they made available. And it's really us who helped manage these grants, but it's the ventures who turn the financial investment into value. And it's really a great way to validate some of their assumptions, but we know from experience that there is a lot more capital needed, financial capital, which we refer to as patient capital. Ventures in disability innovation typically need both finance, but also time to work things through in a participatory way. Moving on to the knowledge capital element, I'd really like to extend my gratitude to the whole mentor team, because this innovation challenge wouldn't have been as successful as it is without their support. Albert, David, Derek, and many others have brought on many decades of combined experience to support ventures on topics like assistive technology innovation, co-design, co-creation, user research, and so on. It's been really working as a team to tackle challenges on everything from AI solutions, the hardware design, and lots of other challenges on the way. But let's not forget also the network capital that we tapped in to be able to bring in all this knowledge. And there, I would like to give a big shout out to Minnie Berg-Ranef, who's been one of our kind supporters throughout the program, who spoke to us as a project team, but also more importantly to the ventures about the possibilities worldview and why it's so crucial to involve young persons with disabilities throughout the whole innovation journey. And I think Kartik put some really nice words behind it through their work as well. But there were lots of other stakeholders who were highly significant to the success of the Innovation Challenge, just to name a few: the UNFPA country offices, but also many of the local communities and other NGOs that we reached out to, for example, schools and other organizations. There's a lot more we could say here, so I definitely encourage all of you to attend the breakout session after this webinar to speak directly to the ventures and find out more from the mentors about the behind the scenes details. So it's nearly time to find out about the ventures themselves and see some really exciting AT innovation. But before I hand you back over to Delicia's hands to meet the ventures, I would like to end on a final remark on one of the lessons we learned that I'd like to share with you. And that's really essentially a case on agility and adaptability. So when we designed the program, we thought, people will need lots of capacity building. Let's organize a few workshops and webinars to help them with some difficult and wicked topics. But soon we realized that actually what's real value in an innovation challenge like this is to give as much time as possible to one-to-one personalized mentorship. So that's what we've done. We doubled down on the mentorship hours. And if we haven't done that, I don't think we would have been able to fly in mentors and experts from Nigeria and Ghana into Cameroon when one of the winners needed to pivot halfway through the program. But we were It was great to see that in addition to everything we planned, in a matter of days or weeks, we've been able to provide in-person support and really work as a team where help was needed the most. And I believe that's more generally true in disability innovation. We need agility. And I'm confident to say that GDI Hub is very happy to offer this kind of support. So with that, thank you. And I'll hand you back to Delisha.
Thank you, Daniel. Thank you for giving a brilliant overview of the challenge and all of those involved. Now, what we've all been waiting for, I will not take up too much more of your time. We are ready to hear from our winning ventures. So we have 4 teams that we will be hearing from. They will introduce themselves, and I will ask, I know it will be difficult, but in one line, if you possibly can, tell us about your innovation and your motivation to be a part of accessibility. Then we will play a short video that will give you so much more information about their work, their innovation, and how they've got to this stage. And then, as we said, you will have the opportunity to ask the ventures any questions and comments. Feel free to leave them in the Q&A box, but at the end of the webinar, we will be sharing links with you where you can get more into it and speak to the ventures directly. But we will run through the 4 ventures now. So without further ado, can I please welcome Accessible from India.
Hello everyone, I am Prashant Ranjan Verma, founder and CEO of Accessible. We are a young team that provides accessibility and inclusion services to organizations worldwide. So I have 2 team members with me. They will just quickly introduce themselves. Yes, Nikhil.
Hi, I am Nikhil Priyadash and I am the technical lead at AccessAbility. Over to Cheryl.
Yeah, I'm Cheryl and I am leading UX researcher at Accessible.
Yes, so we have created an AI-based chatbot that provides information related to sexual and reproductive health and rights. And also, a person with disabilities can use WhatsApp, or they can dial a phone number and get responses to their queries. The responses are credible and accurate and in simple language and conversational style. And currently it supports English and Hindi. So shortly, I think you will see a video demonstrating our solution.
In India, over 26 million people with disabilities lack access to essential information about their rights and benefits, including sexual and reproductive health, which is often shrouded in stigma. Recognizing this gap, we at Accessible have developed a GPT-powered information retrieval system accessible via WhatsApp and IVR. It offers a conversational experience tailored for young individuals with disabilities. User can easily inquire about SRH information and get answers from trusted sources in clear and understandable language.
Hello everyone, my name is Prashant Ranjan Verma and I am the founder and CEO of Accessible. Today I want to briefly talk about our project supported by UNFPA, and the project is enhancing access to SRHR for young persons with disabilities. Launched by UNFPA in collaboration with the GDI Hub and the Global Network of Young Persons with Disabilities. I've been working in the field of digital accessibility and assistive technology for many years, and I have seen the potential of technology in transforming lives of persons with disabilities. I have also been observing that there are millions of persons with disabilities, particularly in countries like India, who are in semi-urban and rural settings, and they don't have enough access to internet, they don't have computers and smartphones, and I have been wanting to make use of the artificial technology to provide some essential services to them to bring about a change in their lives. I'm very happy that through this project, I have got this opportunity. We are able to now create a information service, which is available through IVR and also through WhatsApp. So persons with disabilities, wherever they are, they can very easily, using any basic phone without internet as well, using IVR.
And now I am going to demo our IVR system.
I am Aditi and I am here to help you with information on sexual and reproductive health and rights. If you want me to stop speaking at any time, say Aditi, please stop speaking. Anyways, what would you like to ask me?
मैं इंडिया में एक्सेसिबल वे में प्रीनेटल केयर के बारे में कैसे जान सकती हूँ?
Please wait. इंडिया में एक्सेसिबल वे में प्रीनेटल केयर के बारे में जानने के लिए आप कुछ निम्नलिखित तरीके इस्तेमाल कर सकते हैं। 1. स्वास्थ्य सेंटर या हॉस्पिटल से संपर्क करें। आप अपने नजदीकी स्वास्थ्य सेंटर या हॉस्पिटल में जाकर डॉक्टर से प्रीनेटल केयर के बारे में जानकारी ले सकते हैं। वो आपको प्रीनेटल केयर पास सही गाइडेंस देंगे। 2. प्रसविका, मिडवाइफ या नर्स से बनद। आप एक प्रसविका या नर्स से बातचीत करके प्रीनेटल केयर पास जानकारी ले सकते हैं। वो आपको गर्भवती महिलाएं के लिए जरूरी सावधानियां और तारिका बताएंगी। 3. ऑनलाइन रिसोर्सेज और एप्स का इस्तेमाल करें। कुछ अच्छे मोबाइल एप्स और वेबसाइट्स हैं जो प्रीनेटल केयर के मामले में मदद कर सकते हैं। आप माई प्रेगनेंसी एंड बेबी टुडे जैसे एप्स और बेबी सेंटर जैसी वेबसाइट्स का इस्तेमाल कर सकते हैं। 4. प्रेगनेंसी से जुड़ी बुक्स और आर्टिकल्स पढ़ें। आप अलग अलग प्रेगनेंसी से जुड़ी बुक्स और आर्टिकल्स पढ़ सकते हैं जो प्रीनेटल केयर पर जानकारी प्रदान करते हैं। 5. समुदाय ग्रुप से जुड़िए। सोशल मीडिया प्लेटफॉर्म्स पर कई प्रेगनेंसी से जुड़ी समुदाय ग्रुप्स हैं जहां गर्भवती महिलाएं और उनके परिवार वेल प्रीनेटल केयर पर जानकारी और अनुभव साझा कर सकते हैं। सबसे पहले यात्रा संभव हो जाए, आप अपने डॉक्टर या एक संपन्न स्वास्थ्य प्रक्षालन केंद्र में मिलकर किसी विशेषज्ञ से बात की। आप अपने क्षेत्र की सरकारी या विकेंद्रित स्वास्थ्य सुविधाओं से मदद भी ले सकते हैं। प्रीनेटल केयर बेहद जरूरी है। इसकी तंबाकने से आप और आपके बच्चे दोनों की सेहत को बेहतरीन रख सकेंगे।
Or if they want to, they can make use of WhatsApp also, and they can ask questions, whatever doubts they have, whatever queries they have related to sexual and reproductive health, menstruation, pregnancy, any kind of such topics which they are not comfortable discussing even with their friends and family. They can now have a conversation with our service and get very reliable and credible information. And now I plan to scale up and provide this solution to a large section of the population in India.
Oh, Prashant, I think you're on mute. I can see that you are talking. Thank you very much, Accessible. That was great to see. And like I mentioned, if anyone has any comments or questions, please feel free to leave it in the Q&A box, and we will pick them up later. But you will have the chance to speak to Prashant and his team at the end of the call. Next up, we have Alianta Ifanet from Moldova. Is Alianta on the line?
Hello.
If you could just introduce us to yourself, and then if you can, in a quick line about your innovation, and then we'll move on to your video. Thank you.
Yes, thank you very much, Delisha. Thank you for this opportunity. My name is Mariana Țăbulac-Ciobanu, and I am project manager. Let me introduce my team members who are here. Victor Corol, executive director. I don't know if he is here. And Ion Ciobanu, technical lead, who cannot join now. And Emma Materniuc, interpreter, who is help me with assistance and support in translation. So, what our product is? If you ask me, our product is the same goal of podcast, Overcome Prejudice, to increase awareness and the challenge faced by people with disability from Moldova. About my passion for podcasting, it's for being part accessible. My passion for being part of accessibility is because this is a real way to make the voices of persons with disability from Moldova be heard. And of course, I invite you to watch our video to know more about our project. Thank you very much. Hello, my name is Mariana Țibulac-Ciobanu and I represent the Alianța Infonet. I'm a woman with disability and I'm creator and moderator of Overcoming Prejudice podcast, where we discuss the success story of a person with a disability who have overcome stereotype and prejudice, always finding solution in difficult situations. The challenge faced by people with disability in Republic of Moldova are nuanced by different influence and constraints. The lack of accessibility, both physical and informational, digital, often prevent their full participation in our community life. And social attitudes and misconception help perpetuate stereotype, making it difficult for people with disability to lead their independent lives. Compared to traditional mass media, I think the podcast can bring innovations precisely because here people with different type of disability can create something like intimate environment in which they can openly tell their own life experiences in their own words, why not, which can provide direct and authentic perspective on life with disability. As a producer, my mission was to amplify the voices of persons with disability on a national and international scale. To achieve this, we launched the Inclusive Voices Empowering Disability Content Creators through podcasting. So this was an important activity in our project. About this training course, where was initiative, and we engaged 10 talented young individuals with disability from various regions of the country, from South, North, and Center of Republic of Moldova. Throughout the courses, they honed their creative skills and developed their own podcast episodes. These episodes tackle important subjects such as sexual reproductive health and gender-based violence and the diverse experiences faced by people with disability from our country. The aim is not only to provide a platform for authentic storytelling, but also it's to educate, to challenge misconceptions. By including a more diverse range of voices, we strive to break down stigma and to combat misinformation surrounding disability. So the Inclusive Voices project, it's not just about creating podcasts. It's about fostering a community where everyone's story heard and valued, contributing to a more inclusive and understanding society. If you ask me about my commitments in the future, this is to persist in amplifying the voices of people with disability from Moldova, to enhance and expand this initiative. We are exploring the possibility of establishing a dedicated recording studio or a media creation center. This facility would serve as a hub for creativity, I think, enabling individuals with disability to produce high quality content. If you want to know more about person with disability, you can listen our episodes of podcast Overcoming Prejudice, and you can find us on YouTube channel, on TikTok, on Facebook, on Instagram. But only a little problem is that is in Romanian language.
Thank you so much. So it was great to hear from Alianta. Again, we will have time to speak to them at the end of the webinar. I'm going to move on now to Technoprize Global from Kenya. If you could come online, introduce yourselves and your team, and if you can, in a quick line, tell us about your innovative solution. Thank you.
Well, thank you so much. Hi, everyone. My name is Peter Okeo from Technoprize Global. And I'm here with my colleagues, James from UX Research, Swale Eclavia from the engineering team, and Sharon, who is the end user of our solution. So we came up with a solution that addresses two major issues. We came up with one which is a conversational AI-driven platform, which is a web portal that enables data collectors and researchers to be able to upload their surveys about SRH research, and which also has a capability of carrying out the analysis, which then the feedback that is found can help in terms of decision making when it comes to SRH matters, and this can help government bodies, different institutions. Another bit of this is we also came up with a very interactive and conversational WhatsApp platform that when it comes to data collection, because we noticed that any topic that related to sexual health and reproduction health, it's a very sensitive matter that even researchers shy away from when it comes to data collection. But as Technoprize, we came up with a solution that actually solved that issue. So through this WhatsApp platform, girls and young women with disabilities are able to actually respond to surveys uploaded by data collectors without any fear, without any fear of their privacy being infringed on. So we can then now watch this video. My name is Peter Okeo, Program Manager for Technoprize Global. So at Technoprize Global, we are geared towards creating an all-inclusive digital world for all. And our core mandate is to work with companies and different organizations to help them create content that is fully accessible to all individuals, both with disabilities and without disabilities. And digital accessibility is actually key to when it comes to content creation. And we invite all developers, all designers to ensure that all the content they design and develop is fully accessible. Thank you.
Hi, I'm Sharon, a young girl living with albinism, and I'm going to take an online survey on sexual and reproductive health using the WhatsApp platform. I literally choose the conversational tool over being asked questions by the data collectors, since the conversational tool engages me in a dynamic, accessible, and respectful conversation. At least now I'm able to answer questions with confidence, since the conversational tool gives me a safe space to express my health issues. In terms of privacy, I choose the conversational tool as opposed to the data collectors.
We have developed a conversational tool that will help in collecting data for women and young girls around matters of their sexual and reproductive health. And this will help institutions, governments to have an ease of data collection, since this solution will incorporate advanced natural language processing, and it's multilingual, and it will help reach out to the very basic cases and around data collection with regards to sexual reproductive health. This solution is going to improve the data quality that is collected online, because the conversational tool that we have developed is going to engage the users more, and we look forward to having more and more complete interviews and a better completion rate. Thank you.
I hope you've enjoyed watching the short video about our solution. Please join us, invest in our product, help us to be able to scale the product and collect more meaningful data so that we can come up with solutions for girls with disabilities by making sure they are involved in the process. Please invest in our solution, reach out to us. Thank you.
Thank you, Technoprise. And similarly, I echo that call for all our ventures. If you would like to get involved with them, please do reach out to them. Next, we have Vessels for Development from Cameroon. Again, please come online, introduce yourselves, and tell us in a quick line a little about your innovative solution.
Hello, he's talking. My name is Atangana. I'm a person with hearing impairment, project lead of Vessels for Development, a nonprofit organization based in Cameroon and working towards education and inclusive sexual health. Our team is made up of 50% of persons with disability and more, depending on the projects at hand. We are 7 of us connected here and receive our special greetings. 80% of our beneficiaries are persons with disability. Our solution is a menstrual tracking bracelet for young girls with disabilities, and I'm excited to be part of the AccessAbility because it is innovatively addressing the sexual reproductive needs of girls from my community while consulting them in the process. Discover more from one of our team members in this video. Thank you.
Hello, I'm Ornella Devinil, Executive Director of E4Dev. Several challenges plague the landscape of sexual and reproductive health, which significantly contribute to unwanted pregnancies and school dropout rates. One pressing issue is the intersection of measuring the menstrual cycle, adapted documentation to facilitate access to information on menstrual hygiene of persons with disabilities. Add to that, the financial precarity and ineffective distribution or access to menstrual products, hindering the accessibility of education for countless girls with disabilities. Limited education about menstrual health and hygiene contributes to the perpetuation of myths and misconceptions, hindering proper menstrual hygiene practices and the involvement of caregivers in following up the menstrual health of their daughters. Young girls with disabilities lack access to menstrual products due to financial incapacity the day menstruation appears. They are sent back home or don't go to school when they are on their period due to pains. Prior and timely notification helps them take disposition with their painkillers and sanitary pads. Considering that young girls with disabilities in my community don't have access to smart devices or exposure to digitalization, a device that is cost-effective and simple to use is crucial. And here comes Minscribe, your data-driven menstrual hygiene suite for young girls with disabilities aged 12 to 18 years and up to 29 years, depending on their impairment. The core of our solution is an AI-powered predictive algorithm which forecasts menstrual health cycles based on historical data and user-specific patterns. Our internally designed bracelet, powered by this technology, provides discrete, timely, and non-intrusive notification via vibration, informing users ahead of their period to prepare adequately. The data allows us to distribute our disposable banana fiber sanitary pads and our washable sanitary pads using hubs such as schools, health centers, and more, so the young girl can access the product when it is needed. This is a multi-layered solution designed not just as a wearable, but data-driven, designed for empowerment and for all, irrespective of disability. Menscurb is a user-based centered solution done with the participation of more than 300 women and girls with disabilities, their cycle of care, medical practitioners, and civil society organizations. A product that uses tactile sensing vibration technology to inform young girls of their menstrual cycle and increase access to menstrual product, therefore reducing school dropout and shame. Joined to that is our disability-friendly documentation, a sensitization campaign, and the engagement of cycle of care. From the past version to the current, and what the final commercial version will look like. With further development, we need more support and financing for the device to have more features and reach young girls with disabilities, especially in rural areas. Thank you for your support.
Wow, what can I say? These ventures have been working incredibly hard to research, develop, and deliver. And I would like to take this opportunity to thank all involved and say we're definitely making waves towards effective solutions for complex issues facing women and young people with disabilities in sexual and reproductive health. Now, I know we're running ever so slightly over time, but I would implore you to wait for a final 3 minutes and we're going to have a quick wrap up. I'm going to hand over to Ben Hardman, who is the Head of Innovations at the GDI Hub. He is a designer and engineer with 20 years of experience of bringing innovations to market. Thank you, Ben. Take us away.
Thanks, Delisha. Hi, everyone. My name is Ben Hardman. I'm Head of Innovation, GDI Hub. I'm a male. I've got short, dark hair. I'm wearing spectacles and a stripy blue shirt today. So I get the enviable job of just saying thank you, really. Thank you to the ventures, to our partners, and to all of the guests today. So firstly, huge congratulations to the 4 ventures. This event is about you and the work that you're doing. Fantastic presentations from you all today. And it's been a pleasure, an absolute pleasure to collaborate with you all over the last few months. You know, you're such a diverse mix of talented people and organizations with unique stories. You're all doing amazing work to improve access to SRHR products, services and technologies for persons with disability. And, you know, the world desperately needs what you're doing, but it's super hard to do. And, you know, we've been really, really impressed by your drive, your tenacity, your passion and capability, you know, that you've all demonstrated. And we consider ourselves very fortunate to have been on the journey with you too. So we're incredibly excited to see where you go next and the impact that you'll undoubtedly have. We know that you'll be successful. And then thank you to our partners, UNFPA, Global Network of Young Persons with Disability. So I know this has already been said, but UNFPA for having the vision and for funding such a bold and innovative program, and Global Network of Young Persons with Disability, who've been instrumental in driving thinking throughout the program and in providing invaluable mentorship for some of the ventures. And huge thank you to all the people behind the scenes that have made this possible. There's a vast team that you haven't seen. So from UNFPA, the New York office, the country offices, and to our fantastic mentors, David Baines and Minnie Baragwanath. So I know this is a serious challenge, but we have been able to sprinkle a little fun and joy into the proceedings, which is something that GDI Hub are always keen to make happen. Final big thank you to all of the guests. So almost 500, I think, today. You join us from all over the world, all walks of life, professions, organizations, and academic fields. So an audience that really reflects the diversity and the collaboration of the program itself. So it's wonderful to have you join us and experience the event today. And I hope you found it as insightful and inspiring as I have. So finally, just like to encourage you to all stick around for the next 30 minutes, join the breakout rooms, connect with the ventures, and get to know them a little better. Thank you. Back to Delisha.
Thank you. Yes, thanks, Ben. And as he said, everyone should have been emailed links to the next session where you can speak to the ventures directly. They may well be in the chat, but if you registered, they've also been emailed to you. Please do join them, speak to our ventures, our innovators, our excellent team members, learn more about them, see how you can even advise them, add to them, collaborate with them. There's, plenty of opportunity and appetite for that. So thank you. Thank you from GDI Hub. Thank you from UNFPA and the Global Network of Young People, Persons with Disabilities. Thank you for joining us today. Enjoy the rest of your day wherever you are in the world, and good night.